Lastly, I want to talk about health care, something very near and dear to my heart. For the past 6 years, I've lived the nightmare of Obamacare. It's caused many, many physicians I know to quit, to give it up. Obamacare has reduced us to data entry physicians rather than physicians who can listen and develop their clinical skills as we try to work with patients to solve their health care problems. The Obamacare has led to consolidation of physician practices. It's led to high prices as well for insurance products. It's led to $12,000 deductibles for most families. It's no longer affordable. It's like having no insurance at all. 80% of Americans are not happy with the Affordable Care Act. But I want to assure the American public and my constituents that for every 5 seconds I've spent thinking about repeal, I've spent 5 days thinking about replace. And though quite often the press wants to talk about this as two separate books, this is one book in my life, a book of repealing and replacing as quickly and as efficiently as possible. I want to assure all my constituents back home that if you're on an Obamacare product right now, we're not pushing you off any cliff. We're going to give you a product, a period of transition where you can get back and have a truly affordable health care product that works for you without a $6,000 or $12,000 deductible. We are a party of solutions. If you look at Dr. Price's bills that he submitted the last 6 years, you'll see great alternatives and solutions that the Republican Party has presented. We do think there's good solutions out there. And speaking of Dr. Price, I can't help but just stop and say we need to confirm him as quickly as possible. Dr. Price is a physician, an orthopedic surgeon from Georgia who has served Congress in multiple ways, including leading the Budget Committee. I've not met a man I would rather have serve as the Secretary of the HHS than Dr. Tom Price. A mentor to me, a mentor to many of us, a kind man, a godly man, a person who cares about patients, who understands health care, but he also understands government. Before we can take many more steps with health care, we need someone in that position, and I believe with all my heart that Dr. Price will do a great job. I look forward